Beginning with our cluster B personality disorders, among all cluster B personality disorders, there are some common threads that you see. They are substance abuse, dependency problems in general. They have a very high correlation among your cluster B personality disorders. Spousal and child abuse is common. There is no guilt about hurting others or infringing their rights or exploiting others. Lying, cheating, stealing are all commonalities among personality disorders in cluster B. Criminal behaviors is what places them within the court system and the prison system, actually more than you see them in the mental health system. You will see these people in jail and prisons, and generally the problem is always going to be someone else. It's never going to be themselves. They never take responsibility for those behaviors. They may appear initially to be very charming and intellectual, usually smooth talkers. They can deny and rationalize their behaviors. There is a non-existent guilt. They have no sorrow for their offenses, no loyalty. It is as if they have no conscience. Your antisocial personality disorder begins in childhood with tantrums in infancy or early adolescence, are sometimes seen as bullies, and then later diagnosed with antisocial personality disorder as an adult. It is said that antisocial personality disorder individuals are unaffected by pain thresholds like other people are. Also, attention deficit disorder and conduct disorder increases the risk for antisocial personality disorder. Antisocial is the oldest personality disorder and most researched. This is more common among lower socioeconomic classes, more common among men. These individuals lack community ties. They present in a very cold and callous, cruel demeanor. They lack warmth, and they're usually suspicious of those who have those traits. They have a low toleration for frustration if things do not go their way. If things are good for them, they're usually very happy, go lucky, charming. But if they perceive things to not be going their way, they become very furious and look for vindication. They have rapid mood swings. They are dominators, and they hate weakness, but then will see themselves as the victim. They accept no responsibility. All of their behavior is justified according to them. They do not have meaningful relationships because they are only able to trust themselves, always out for number one, and will stop at nothing. They disregard authority and rules. Repeatedly violate the law, very intimidating and manipulative. They have no consistent employment because of these behaviors. They are termed as thrill seekers. So why does someone become an antisocial personality disorder? It is said that there is a familial link or a first-degree relative or parent also diagnosed with antisocial. Antisocial parents who have children and are even separated at birth tend to have children that still display the antisocial personality disorder traits as adults. In general, a child living in an antisocial personality disorder home, meaning that a parent who has antisocial personality disorder, the home life is generally very chaotic. There's a degree of parental deprivation or separation from parental delinquency during the first 5 years. There's also very inconsistent and impulsive parenting. There may also be severe physical abuse. There's never any consequences for the behaviors of the child. The child models these behaviors, and it is said to have long-term damage done to the central nervous system, in which it enrages and instills anger and hostility in the child. As a healthcare provider, We must set firm limits and enforce the rules. We must always continue to apply consequences to behaviors. With your borderline personality disorders, we're going to spend a little bit of time on this personality disorder because borderline is the most common personality disorder. It is more common in women than men. Involves severe, rapid mood swings, poor self-image. This is someone who always finds themselves in crisis, even if it is a self-imposed crisis. They have extreme intensity in emotion, frequently change mood from, anxious to agitation to anger, and these mood fluctuations can change within minutes or hours or days. They often have a dominating effect. That affect is usually depression. Projective identification is displaced angry feelings onto others to justify one's own feelings of blame. They blame others to deal with their feelings, and they're seldom aware of their own feelings. They have a fear of abandonment so much that they really have no tolerance for being alone. No matter how unsatisfying a relationship is, they will stay in that relationship to avoid being alone. Generally, you will see recurrent self-mutilation with borderlines. The hypothesis is that they have a higher endorphin level that increases their pain threshold. The theory says that borderlines are in a state of derealization, and they don't initially feel the pain, so they continue to inflict pain on themselves until they can feel it. This is an attempt to counteract the otherwise nothingness that they feel for emotion. This helps them to validate that they exist, according to some borderlines, when you ask them why they self-mutilate. Clinging and distancing. Clinging for this individual is overwhelmingly the need to be with and constantly seek reassurance from their significant other. And if they're not able to get this constant companionship and unrealistic reassurance, then they'll act out, and sometimes their acting out behavior is to self-mutilate. And then the distancing behavior is the extreme anger and hostility, the devaluing of their significant other. And because they have such discomfort with closeness or separation and confrontation and limit setting, it's very difficult to maintain a relationship with a borderline. One minute they want all of your attention and constant reassurance, and then without provocation it may change to discomfort and separation, anger, hostility. Splitting occurs when they see themselves and others as all one or all the other. They either see a person as completely good or completely bad. They can't see any variation. One minute the individual will be idealized and valued and loved until something jeopardizes this relationship, albeit big or small, and then the total opposite emotion is displayed. The borderline will devalue the significant other and display hatred almost immediately. The borderline will manipulate to avoid abandonment. They will resort to any behavior. They will pit one against another. The self-destructive behavior is repetitive, and it can be fatal, but if it is fatal, it is usually done as an accident. Because when a borderline is self-mutilative or self-destructive, they're doing it to get a response or to punish their significant other. They plan their self-destructive behaviors in a way that someone commonly can respond to them quick enough to keep them from dying. such that if their significant other tried to leave them, they would be the type of person that would call them and say, you know, because of you, I'm going to kill myself. This is all your fault. I have just taken a bottle of, you know, whatever. And then they will hang up the phone knowing that someone will come and rescue them and, you know, get them to the emergency room and have their stomach pumped. And it's all a ploy for punishment of that significant other for attempting to leave. However, sometimes they do accidentally, you know, follow through with a suicide unintentionally. It is that impulsivity that they learn very early on. They learn to process situations and their function is impaired. Generally, they will introduce substance abuse or gambling, promiscuity, or reckless behaviors. This occurs in response to either a real or a perceived abandonment on the borderline's part. Histrionic personality disorders are more common in women. Usually they begin in early adulthood. They are characterized by a self-focus, attention-seeking. This is done through dramatic behaviors. They're very manipulative. They are exhibitionistic in their behaviors. They demand to be the center of attention. It is a roller coaster ride of joy versus despair with your histrionic personality disorder. They're socially seen and generally accepted as well-liked persons. They are successful, popular, outspoken, and even attractive people. But in reality, inside, they are all consumed with a need for approval. They're desperate for that approval, desperate for affection. They will attract attention to themselves at all cost, negative attention or positive attention, so that they're overly concerned with how people perceive them. They need to be admired constantly. They don't have any care for detail. They're not detail-oriented people. They're more carefree. They are sophisticated and at the same time insecure and naive. They are very impressionable, strongly dependent, which makes their relationships normally short-lived and superficial because they lack that ability to give genuine affection in return. Also, when they don't get their way, they believe that they're being treated unfairly. They feel dejected, and dejected means hopeless and desperate, in despair, forlorn, desolate, inconsolable, brokenhearted. Whenever their anxiety is increased, they usually manifest some types of somatic complaints and may even experience brief episodes of psychosis during extreme stress. So why does someone become a histrionic personality disorder? Well, neurobiologically speaking, there is a hypothesis that this individual has a decrease in serotonin, which leads to their impulsive behaviors. Hereditary, if there is a first-degree relative with a histrionic personality disorder or parents, this is generally passed on as a temperament disposition to their child. Psychosocially, this is learned as a child, that positive reinforcement as a child came from their ability to constantly be admired by and please their parents. Likely there was really no positive and negative feedback from their parents. Their acceptance was very inconsistent, and they only received praise at the highest level of their parental expectations, which was very difficult to achieve. As a nursing professional, we must help clarify the patient's true feelings because most often they are not in touch with their true feelings. Help the patient to return to an area that they can learn to appropriately express their feelings once they've identified them, and to react in a more positive and healthy manner. Your narcissistic personality disorder is the pervasive pattern of grandiosity. They're overly sensitive to the evaluation of others. They have a very fragile self-esteem. They believe that they have a right to receive special treatments simply because they feel this way. And this mentality gives them an impression that they're justified in doing whatever it takes to get whatever they want. This behavior begins in early adulthood. It is more commonly seen in men. Their mood is optimistic and cheerful, carefree, usually, but it changes easily. They have a very high self-expectation. They demand positive feedback from others. In fact, they expect feedback to be positive and praise. If they're not given this, then they can respond with rage or dejection. This rage and dejection can be turned inwardly, and they can convince themselves of their perfection. They will exploit others in order to make themselves feel better about themselves. In fact, they will search out and choose a mate that provides them with the praise and worship that they require, but in return asks them for very little. So why does someone become a narcissistic personality disorder? How is this grandiosity about self and achievements and this overvalued behavior ingrained in someone? Well, as a child, it is hypothesized that their fears and failures, their dependency on their parent, was met with criticism, disgust, humiliation, or neglect from the parent. The child learned to display self-sufficiency and invulnerability. They do this to hide their true feelings of contempt for these behaviors in themselves. They feel very empty, and they have a true inability to care deeply for others. Hereditary speaking, narcissistic parents were usually very demanding perfectionists, very critical of their child, with unrealistic expectations placed on the child. They had physical and emotional neglect and withholding true love from the child, and the child began to model this behavior, which only continued in adulthood. Environmentally, the parents attempt to live vicariously through the child. They expect the child to achieve things that they could not achieve, to possess things that they could not possess. And the child then begins to dominate the parent and to believe that they are above rules and regulations, that the general societal rules for others their age do not apply to them. And that also continues into adulthood. As a nursing professional, you want to point out the discrepancies and attempt to increase the patient's responsibility for their actions and behaviors, using limit setting and consistency to try to decrease any manipulation or any behaviors of self-entitlement that they might have. Beginning with our cluster C personality disorders, we have the avoidant personality disorder. This is characterized by social inhibition, feelings of inadequacy, extreme sensitivity to negative evaluation, and general overall avoidance of social interaction. Now, what makes this a little bit different is that it's not that they wouldn't like companionship, they would, but they fear the rejection, and the fear of the rejection is actually a stronger emotion than their desire to be part of a relationship. So that's a little bit different from some of the others that we've talked about. The avoidant personality disorder actually does want to be in a relationship. They require unusually non-critical, non-judgmental people that can give them a guarantee of a solid relationship. So they avoid these situations because they can't get that guarantee in which they may never be disappointed or rejected. Avoidant personality disorder is equally common among men and women as far as the diagnosis. From a distance, they might appear very differently than they do when you become a little bit closer to this person. They are very sensitive, very touchy, evasive. They do display a mistrust of others. Their speech is notably slow and carefully crafted. Their speech is confusing and circumstantial. This is likely because they are so preoccupied with what others are thinking about them that they have difficulty formulating the next sentence because they're trying so hard to think of exactly what they need to say so that they won't be rejected or looked upon in a negative way. They do not want to feel inadequate, and they already feel inadequate. They will try to fill any silence in conversation in. They have difficulty formulating relevant statements. They will just kind of babble on just to keep from having that awkward silence. They view others as being overly critical, untrustworthy. They generally think that people are just out to humiliate them. This person is often angry and anxious, even depressed with themselves for not being able to develop that relationship that they strongly and deeply desire. So why does someone become an avoidant personality disorder? Well, it seems to occur more frequently in certain families. In infants, it is seen as irritability, a tenseness that withdraws from human touch and cuddling. It is this increased temperament that possibly leads to the avoidant personality disorder as an adult. Psychosocial, they say that the avoidant personality disorder is created from parental rejection and belittling, critical abandonment from the parent. The child learns to replace any optimism or hope with a low self-esteem and alienation from others. This causes them to generally be seen as odd or weird as a teenage peer group, so they have to endure peer rejection. From a nursing professional, we want to try to help gradually confront the fears and support and direct this patient to accomplish small goals at a time. They need to be successful. They need to learn to be assertive and to develop their social skills. This does include interactions with others, but you can only include these interactions as the patient is able to tolerate. They have to be able to accept negative and positive feedback to be able to benefit and have a real success from treatment. And this is not something they're going to be able to do quickly or very early on. So that's why I say that it has to be done with interaction and developing the skills with others as they can tolerate it. The dependent personality disorder. This is a disorder where psychological dependence on other people leads to profound fears of separation. They will tolerate being mistreated. They will demean themselves, underplay their attractiveness, or downplay their accomplishments, all in order to gain acceptance. They will even engage in unpleasant or humiliating acts just to get the approval from someone. They're incapable of being dominant in any situation. They have difficulty making very simple decisions, such as what clothes to wear, how to spend their day, what jobs to pursue. This is more common in women, and it's generally seen as a more common thread in the youngest child of the family. They overall lack confidence. They have poor posture, a low tone of voice, avoid responsibilities, and become very anxious. They will put the needs of themselves aside in order to meet the needs of others. They're seen as overly generous. To others, they seem very upbeat and cheerful, but in truth, they feel very pessimistic. They feel discouraged, defeated, or dejected. They're very easily crushed by even the mildest of criticisms or disapproval. They will maintain attachments and do things to keep others coming back to them. If a relationship ends, then they become very overwhelmed with a fear of being incapable to take care of themselves or to care for themselves. And they will make quick efforts and attempts to reestablish a new connection or a new relationship to anyone that will give them guidance or tell them what to do. So why does someone become a dependent personality disorder? Well, hereditarily speaking, the hypothesis is that there is a genetic predisposition. This seems to be even higher among identical twins than fraternal twins. The psychosocial theory says that this is learned helplessness, that it is fostered in infancy when all of the infant's needs are met only by one person or one source. And if this continues into childhood, then dependency on that one person is nurtured. The one person or the primary caregiver tends to be extremely overprotective and minimize a need for new experiences for the child, or they will make the new experiences so very easy that it decreases the child's autonomy. Thereby, the child learns to fear disapproval if they become too independent, and they are rewarded for dependency on that caregiver. As a nursing professional, we need to help this client learn to make decisions for themselves. They have to assume responsibility slowly, as they are able to do. We also have to take into consideration how to help to reduce the anxiety that will be increasing and that this patient will experience as they attempt to be more responsible. Teach them ways to verbalize their feelings and ways to cope. This is essential for this very dependent personality disorder person. Obsessive compulsive personality disorder. This is an individual that is overly disciplined and very inflexible about the way things must be done. They are devoted to being productive, even at the expense of their personal needs. They have an intense fear of making mistakes, which leads them to be conflicted over their decision making. Obsessive compulsive personality disorder occurs more often in men, and in families it is seen more common in the oldest child, which is just the opposite of what we saw with the dependent personality disorder, which was normally seen in the youngest child. Your obsessive compulsive client feels anxious when they are perceiving that they are not getting things right. They set very high standards for themselves, and that they believe their work is never good enough. They rank consciously superior, and it's kind of like them against us. They see everyone as being either superior to them or inferior to them. They are very envious of the people that they perceive as authority figures or superiors to them, but they do not interact well with those that they perceive as inferior to them. They're very pompous and self-righteous to those they perceive as inferiors. They can be very loyal and dependable, responsible, and display responsible behaviors, or quite the opposite. If it's someone that they do not respect, they can display contempt. They have no tolerance for people that they see as acting frivolously or impulsively. They're not very emotional people because to an obsessive compulsive personality disorder person, they see emotion as being immature or irresponsible. They might appear very calm and controlled on the outside, but underneath they are dealing with feelings of hostility, confliction, and ambivalence. Commonly, they will use the defense mechanism of reaction formation, meaning that they adopt affects, ideas, and behaviors that are just the opposite of the impulses that they feel on the inside, either consciously or unconsciously. Also, they experience isolation, intellectualization, and rationalization as common defense mechanisms. So why does someone become an obsessive-compulsive personality disorder? It is theorized that they had parents that expected them to live up to imposed standards of conduct that were impossible to meet. And then the child would experience condemnation when they could not meet these standards. They would praise the positive behaviors much less frequently than they would punish the child. So a positive behavior was expected but not rewarded. Punishment for mistakes and pointing out the child's shortcomings were frequently experienced by the child. With all of this, the child learns what not to do to keep from being punished rather than what they can do to receive attention and praise, because the attention and praise was really never freely given. As a nursing professional, we attempt to assist this patient with their decision-making skills and to encourage them with following through with their tasks and behaviors. However, the patient does lack an awareness of the way that he or she affects others, so we need to help them look at and try to understand how others might view them. We also need to help the patient learn that it is okay to make mistakes, to help decrease their irrational beliefs that everything has to be perfect and that in order to be valued, it is necessary to act in a perfect way. Your passive-aggressive personality disorder. Now, these individuals resist the demands for adequate performance in social and occupational situations. They have a passive expression of a hidden aggression. It generally begins early on in childhood. Your passive-aggressive personality disorder client generally feels cheated by their life. They harbor deep-seated resentment for those that they perceive as having things handed to them, having life easier than themselves. They will go to great lengths to get even with others, but they do it in a disguised manner. They are not confrontational. They will not discuss their feelings with the person that they feel has wronged them. They're very resistant and can cause these subtle obstructions in response to others' expectations. For instance, they'll ask to do a task or volunteer to do something, and then will put roadblocks in their own way that makes it impossible for them to finish that task. They will play the martyr and then switch the role. An example of that is, oh, I misunderstood what you wanted, or maybe you misunderstood me. I didn't mean that I was going to do that. And then they'll play that I feel so guilty that things fell through. They also have a tendency to manipulate through the sickly persona. This is their way of venting their frustrations and hostility, their anger and resentment toward others, while at the same time they can get attention and recognition. They get someone to reassure them and to care for them. So why does someone become a passive-aggressive personality disorder? It is said that this was a child that grew up with parents that were inconsistent. They were unpredictable in their behaviors, their actions, and their attitudes. Without warning or reason, the parents would either pour out kindness and support on the child, or without reason or warning, just the opposite would happen. They would respond to the child with hostility, humiliation, rejection. So, of course, the child becomes very conflicted about themselves and about others as well. They become very confused as to whether they are competent or incompetent. They don't know if they're a good child or a bad child. They begin to be very unsure if they are loved or hated. They begin to wonder and not understand whether or not they love or they hate the people they depend on. There's a very double-blind communication in this upbringing. That means that, the expression of love to the child is said, but then the behaviors were neglectful, and they took away true emotion. The parents took away true emotion to the child. That's such as, the caregiver telling the child, I love you more than anything in the world, but then not bathing the child or cleaning the child or preparing food for the child and sending the child to bed hungry for no reason, for no behavior. This approach then becomes what the child models. They model it in their thinking. They model this behavior in their actions. And they learn to control anger because they don't know what's going to provoke this parent, this very inconsistent and unpredictable parent behavior. So they control their anger, and they don't want to do anything that's going to cause their parent to withdraw that love and support that they strongly wanted. Even if they can't predict when this parent's going to withdraw that love and support or what behaviors they might exhibit that causes it, they just walk on eggshells, trying so hard not to do anything wrong. Now, inside, this child is struggling with feelings of hostility, inefficiency. They're just really overwhelmed. But outwardly, they possess a very polite, likable, social disposition.